Positioning. Semi-fowler. Semi-fowler. Position, semi-fowler. O2. Right? O2. This is the nurse. The doctor, he got PE. What drug you see the doctor may order? Heparin or what? Thrombolytics. Because this is emergency. Any question? You see how smooth it is? And this is what makes the patient go into heart failure. No, I can't be both. No, you know, or. Nobody, hey, no. No, I said heparin. Monique, they met me fatigue, my jump this, baby. Oh, and they have probably some babies while they no, guys, you will never give heparin and thrombolytic. But Monique, même student, you're going to say. They met their food, somebody was going to say, hey. Now, who cannot get thrombolytic? Patient who have history of what? What else? One more. Whoa, ischemia. Renal. Anytime you have history of kidney problem, you cannot take it. And a person who your blood pressure can go down, you cannot take thrombolytic. You remember page 707, contraindicated? What? Right there. You see, because we didn't know that, that tell me we not studying Monday, Tuesday, med-surg. Munan diri no la sa di musonyoli. Because if you was reading like I send you to do the schedule, right? Any question? Okay, so DVT scratch, valve disease, endocarditis, heart failure. Okay, now we on PAD. PAD term. Okay? And only read what I give you to read. Please? All right. Peripheral arterial disease. Now I'm going to raise the heart because it looked crazy. It's too much. Okay? PAD. Peripheral arterial disease. Right? Ready? We just gonna do the heart. PAD. It's on page peripheral. It says arterial. 692. You got it? It's a chronic disorder in which partial or total arterial occlusion deprives from the lower extremity. Anytime you're reading, you got to read what is the disease. What I'm finding is you guys listen to tape and you're not reading. You must read the book, okay? Now, tissue damage occurs below the level of the arterial occlusion. What caused the peripheral arterial disease? Atherosclerosis. So there's type of occlusion that's in the arterial of the heart that preventing blood from flowing from heart to feet. Now, when you have PAD, let's look at the leg. 99.9, all the problems happen in the leg. So I'm going to draw the leg here, big leg. You know, big green mark, a black mark. Now this is very big on NCLEX. Sometimes NCLEX give you the picture. right? So this is the toe, this is the leg, right? So if the patient have an ulcer here, so on our leg, you can have an ulcer here. You can have an ulcer here in the heel, which is diabetic ulcer. Stay with me. When you have an ulcer here, it's a venous ulcer, vein, and you need steroid. This one, since it's a diabetic ulcer, you need insulin. When you have peripheral arterial disease, créole, malin là, c'est sous un pied. English, the ulcer with PAD is on the toes. So the ulcer is in your toes. That is PAD. The leg is skinny. The leg is cold. The big toe, remember all of our toes got little hair on it, right? His toes, there's no hair. The malin, the ulcer is on the toes. The whole leg is shiny, cold, and African American black. Who gets this and what caused this? Not taking the blood pressure medication. Hypertension caused this. Uncontrolled hypertension. Okay? Now, so NCLEX give you the leg. They normally give you the picture. If the ulcer is on the side of the leg, which young people normally get, it's a vein problem, they will give you steroids. So we will isolate this patient because of the steroids. If the ulcer is in the heel of the foot or the plantar of the foot, it is diabetic patient. If the ulcer is on the toes, it is a peripheral arterial disease, and we will give Plavix. The drugs we give is Plavix for PAD. Now, how do you know the patient had PAD beside the leg cold, the leg shiny, blood pressure on arm is higher than blood pressure on leg, is when the patient walk. Shh. When the patient walk, the patient have a pain that is called rest pain. This patient, that rest pain, has another name, and it's called intermittent claudication. That means when the patient walk, the patient has the worse the disease get, the shorter the distance the patient can walk. This patient, you have to teach them how to use a cane. And that's where NCLEX brain, the cane walking, crutch walking, how to walk with a cane in situation like this. This patient, we cannot keep that bad foot, the bad leg, so not coupe. This patient will get amputated. Any question? Now, what would you use for this patient? A Doppler, right? What tests will the doctor order? Blood tests, cholesterol tests, because it is atherosclerosis. The machine tests the doctor will order. The doctor will do a cardiac cath, and in the cardiac cath, he'll see the artery that runs from leg to heart, there's a blockage. What drug the patient will be on for the rest of their life. Plavix, and they will take 181 milligram aspirin daily. Now, the reason we're not giving this patient Coumadin, because that's not the problem. The problem with the patient, the atherosclerosis preventing blood to flow. So you need to give them Antiplatelet, which is a blood thinner. Coumadin, I don't know why students say Coumadin is a blood thinner. You got to watch what you say. Coumadin, right, is an anticoagulant, right? Break and prevent clot. Aspirin, Plavix, Antiplatelet, Agronox is what we call blood thinner that cause blood to flow. Any question? What? Yes, what you said? Oh. That which one you want me to repeat? All of that? That means you're not taping. I would not. That's too much energy. No. Which you want the medication? Plavix, aspirin, Agronox. They on page 707. Box, I'll tell you. Antiplatelet, 707. I'll tell you what page to get them, right? Because we need. It is on page 7, actually it's 708, box 51-4. Repro, Plavix, Agronox, and Antiplatelet are the drugs you give. Okay, remember we all should be taking. Okay, and you should be writing in the book instead of writing on notes, because if you write everything on notes, you're going to miss what I'm saying. Write the notes in the book. College 101. All right, let's go. So now we did PAD, right? Any question on PAD?
Miss Sonia.
Yes.
You said ulcer in plantar gives steroid, right?
What?
Ulcer in plantar area gives steroid.
Ulcer in vein gives steroids. Look at the picture on the board. That's what I said. Okay? Okay, now we're going to go into what we call AAA. I don't have AAA on the board. Woo! Before we go to Lindon, AAA. AAA, which is very important. AAA is on page, it's 694, and then we'll do Lindon. Aortic aneurysm. Okay? AAA. You see AAA? Okay. Aortic aneurysm. Aneurysm is a stretch, right? Some type of stretch, right? When you have high blood pressure and you don't take care of your blood pressure, take your medication like you're supposed to, what happens is the artery and the veins stretch. And when they stretch, they can rupture and you can die of sepsis. So, let's go. There's two types of aneurysm. So let's read what is aneurysm. Aneurysm, aortic aneurysm, is an abnormal dilation, mean open, a spread, of the arterial wall that cause localized weakness and stretching. The aneurysm can be located anywhere along the abdomen aorta. So it can occur on your abdomen and it can occur in your thoracic. So there's two types of aneurysm. AAA, which is called abdomen aneurysm, or one that is thoracic aneurysm? That was my NCLEX question. Thoracic aneurysm, because it's the chest, of course the patient will have shortness of breath. The patient will have hoarseness, weakness, because it's respiratory. Then you have abdomen aneurysm. The patient will have lower back pain. On the stomach, on the aorta, there will be a bruit. The stomach will be an abdomen mass. That is the abdomen. So there's two types of aneurysm: thoracic and abdomen. Now, when the aneurysm bursts, that rupture, whether it's thoracic and abdomen, this is how the patient died. Ready? When you have the aneurysm burst, pété, rupture, the patient will have severe abdomen pain or back pain if it's abdomen. If it's respiratory, the patient will automatically have shortness of breath if it's the thoracic one. Lumbar pain, the patient will be tachycardia, hypotension, because the patient will be shocked. And what room, what hygiene and safety, sepsis. What is the room you going to, how are you going to dress for a sepsis patient? Droplet. Not contact, droplet. Okay? This patient, signs of shock. Hematoma in the flank area. Nursing intervention for AAA. Monitor vital signs. Why? Let me ask you a question. If I'm in shock, which vital is priority? Blood pressure. Okay. So what's nursing intervention important? Fluid. Remember, I'm bleeding internally. I'm losing blood. So you give me fluid. And after you give me fluid, what drug you going to see the doctor order? Keep it simple. Forget about the book. I'm in shock. You just say, give me fluid. What else? No, come on. Keep it simple. Why would you say, listen, let me show you how LASIX don't make sense. Be quiet. Shh. Now I'm pissed off because we saying stuff all sideways. Look, if I'm bleeding inside, that means I'm losing blood. If you give me LASIX, what would happen? You losing blood. So do you see why it don't make sense? So let's talk again. Okay. You give me fluid because I'm losing fluid. You remember, infection is in the blood. That's what it's called, sepsis. So what's next? Antibiotic. You see how stuff makes sense? I'm losing blood. You gave me antibiotic. Position me when I'm losing blood. Trendelenburg. You got it? After you give me the fluid, and I'm good, you listen to the lungs. If I have fluid overload, you take it out with what? Give me the stuff with understanding. But you don't go give sepsis patient no damn LASIX. They losing. You just killed them. Ooh, we gonna take that license. Leave it on the table. You guys, I need you to say stuff because it makes sense, not because it feels good, right? Because we pumping this patient with fluid. Of course he can go to fluid overload. Now, what must we do with this patient? Nursing intervention. You already say listen to the lungs. What else? INO, yes. What else? Weigh them. Weigh them. weigh them. It makes sense. Okay? Weigh them. Check them. How do you know all the drugs, all the intervention you did is working? You remember that stomach pain they had? Ask them, do you still have that bad pain? Listen to their lungs. If it's thoracic, you remember they had what? Shortness of breath. There you go. Any question? And what caused it anyway? What caused the problem? Uncontrolled what?
Hypertension.
So what are you going to teach me? Because you on blood pressure for the rest of your life. Good job. Guys, you see, stuff makes sense if you just take time to understand. This stuff is easy, right? Don't you guys? Now, a lot of you guys, this stuff's so easy, you can't believe you actually understand. You like, pinch me, I'm dreaming. Is that all I had to do? Yes. A lot of you guys went to nursing school and just kind of waste your time and thought school is hard. This stuff is real easy if you put the right time to attack it. And you do understand it. All I'm doing is facilitating. If you read, you got this. Go get your license. But if you don't study and saying stuff all wrong, you ain't gonna be no nurse because stuff all wrong. And if you do got the license, you ain't gonna know what to do with it because you really don't understand. You gotta make it work. And you got to understand the procedure. This is not science. This is not that hard. It's just a little grinding and working. All right. Then we go to renal disease. Renal disease and Berger disease, we're going to do them together. It's the same thing. Take the notes in your book. See, 693, renal, we doing B and C. It's your book. You ain't going to give it to Shakita after. Write in your book so you can see what I'm talking about. Right? Renal disease and Berger disease are same disease. But let me explain to you. And be careful when I say same disease. Because you know students say, but you say. It is the same disease where veins are occluded. But with Berger disease, it affects your hand and legs. Renal disease, it affects your nose, your hands, your cheeks. Berger disease, it only affects your hands and your toes, your leg, so they can amputate you there, right? Now, renal disease, although the patho is the same, occlusion of the arteries and the veins. Renal disease, girls normally get it. What girls? White girls. It is genetic. They have good days, they have bad days. Let me rephrase that. They got exaggeration and remission. Stress can cause exaggeration. Period, menses, pregnancy cause exaggeration. Right? Temperature, cold. So people live in Minnesota, really cold area. Remember I told you little girls, smoking can cause exaggeration. Right? Coffee. Berger disease, the other name for it is called thromboangiitis, obliterate. Smoking causes it. When I say caffeine, I don't have to say smoking. It's understood. Right? Berger, boys get it. Now, renal disease, we call it the American flag disease. First, it gets red. Then it turns white. And then it turns blue. Linoleum. We call it the American flag disease. Red, white, and blue. Burger disease, we call it white, blue, and then the blue turn black. And the reason white gentlemen get it, their leg cut, because of the burger disease. Now, what drugs do we give for both? Drugs. Okay, I'm going to talk about that. We give a drug called Procardia, which is a calcium channel blocker. And then we will give them nitroglycerin to keep it open. But the drugs you give them are Procardia, which is a calcium channel blocker. Any question?
That's for both.
Procardia. Both disease, you give them Procardia. And you also give them vasodilator, nitroglycerin. Any question? And it's teach them. No smoking. Okay? Any question? Yes. Shh. Uh-huh. You will give them antispasmodic drugs if it desires for spasm. You'll give them baclofen, but that's not going to fix the problem. See, if you have breast cancer, God forbid you have chronic pain, we give you morphine that did not fix the breast cancer. So the vasodilator is the problem. So you need to give them the drug to fix the problem. The morphine that we give cancer patients is to cover the what? The pain. But the medication for cancer is what? Chemo. So the vasodilator is to fix the problem, and the antispasmodic medication like baclofen, Soma help with it. You'll get boulette. Remember, it's cold. But once you get vasodilator, it fixes the problem. Any question?
So both are genetic?
Both. Renal is more genetic. Burger is acquired. You guys know what acquired means? You got it. You're born with AIDS and you acquired AIDS. That means later on in life you got AIDS. Burger disease, 99.9, you got it from smoking, drinking coffee, right? Chewing tobacco. Okay? Okay, our last disease in blood pressure, our last disease in cardio is blood pressure. NCLEX blood pressure out. They don't ask you no more what caused it. They don't ask you what caused blood pressure. Charlie, blood pressure out. They ask you the medication. They ask you risk factors, what food, who gets blood pressure, how to take a blood pressure, all the skills that come with blood pressure. So, now, hypertension, I'm on page 696. Now, first of all, let's talk about the systolic versus the diastolic. Let's say the patient's blood pressure is 120 over 80. First of all, this is no good no more. You guys know that.
Yeah.
This is called pre-hypertension, right? Now, the problem is not the top. Y'all know that. The problem is the bottom, right? So, we as nurses, doctors, we can lower the top. If your blood pressure, the top was 160, and I tell you, come in here and sit down, and I give you a little water, I tell you, breathe deep in, give you incentive spirometer, if I have a little oxygen, give you, do you know the top will go down? The top is not the problem. The bottom is the problem. So, let's go. There was a party Saturday, a wedding. And you party from 10 o'clock, 10, 11, 12, 1, 2, 3, by 4 o'clock, you can't party no more. So, the bottom of your blood pressure, which is called the diastolic, it's supposed to take a nap. What happened is, if it does not take a nap and continue to go up, you will collapse and go into heart failure or stroke out. High blood pressure, anytime you do not fix it, you go on one-way stroke. Once you stroke out, you then go into heart failure and you die. This is your concern. So on my mama and papa, I have a question where I say 100 over, I think I got 160 over 99. And the students say, this one bad. This is the bad one. Right? That means the left ventricle is just not resting. You keep galloping like a horse, you will eventually crash. So, there are two types of hypertension. Primary, secondary. Primary means you're born with this, family, not born, pardon. Genetically, it's in the family, right? Age, blacks. The older you get, the higher your blood pressure gets. Blood pressure has nothing to do with, I don't want to say it has nothing to do with obesity. I have to watch that. A lot of people feel just because you're skinny, you don't have blood pressure problem. Wrong. It's not only big people that got blood pressure problem. Skinny meanings too, stroking out because of they have blood pressure. Right, you see you studying here, right there, your blood pressure is high. Okay? So you gotta make sure, you gotta check your blood pressure. Go to Publix and Walgreens, they got those machines, and you check your blood pressure. Family history, black people, male, our husband, go work 3 jobs. He's dying. You send him to go work 3 jobs. Obesity, smoking, even smoking marijuana. Yes. Right? Stress, NCLEX, put stress NCLEX. Can't pass NCLEX, hell, put that too. Right? Excessive alcohol, crack, cocaine. Right? Hyperlipidemia, high fat. Salt and drinking coffee. Those of you who drink, you're supposed to drink 1 cup of coffee, and you're supposed to drink it in the morning. My student drink coffee night, day. How can you drink coffee at night? After 8 o'clock, no more coffee for me. Boy, my students, they drink coffee. That's why I say they crazy. There's something wrong. Sometimes I don't bother y'all because the student drink coffee 10 o'clock at night. I'm like, what's wrong with you? Right? Early in the morning, that's it.
Trying to stay awake.
You working all them hours. No good. Yes. Hypertension, because it's just genetically why. No, hypertension is everywhere. But hypertension is everywhere. When we did culture, you see Spanish, black, white. But black people, guys, come on. Black people get it more because of misère, poverty. We're not eating properly. See, when we don't have, a lot of Caucasian people have because the parents had it, so they pass it on. So they'll go to health food, the expensive place. We have to hit the corner store because that's all we can afford. So we eat what's available, but they eating the good stuff. And that is why it is. Why do Caucasian people think when you look at them it's a sign of respect? Why do a black person, when you look at them, although you admire the shirt, you automatically think something wrong? It has to do with slavery. The root, all right? So hypertension is very big in our community because of what we eat. And breast cancer is big in Caucasian. However, the Caucasian lives longer because it's not accessible and available because black people got Medicaid and white people don't have Medicaid, they pay. But white Caucasian people will always go to the hospital. Doctor, anything wrong? I'm here to check this. Black people, although you have an insurance card, you never use it. So that is why you see the discrepancy on who died of this versus of the other race. Because we go work, we go to the nursing school, we work 50 million hours, but we don't go to care for ourselves. And that's what happened. All right? So it's not because Caucasian people don't have Medicaid. They'll tell you, I don't want to go wait in the line. I'd rather pay. Black people, everybody got a Medicaid card. But nobody don't go to no doctor. All right? Okay. Now, secondary hypertension is I acquired it because I had something like PIH, I'm pregnant, renal, people who have nephrotic syndrome, kidney disease, endocrine problem, right? These people acquired hypertension. Now, blood pressure is, ready? Manageable, treatable, but not curable. You got it? Manageable, treatable, but not curable. Diabetes is manageable, treatable, type 2, and curable. Type 1 diabetes, manageable, treatable, but not curable. Type 2, manageable, treatable, and curable. Go lose weight. Type 2. Now, when you have blood pressure issue, we give you blood pressure medication. When do we give them to you? First of all, back in the days, this was good. No more. When you are 120/80, the doctor can start you with the baby ones, they can give you Flomax, right? They can give you Clonidine. They will not give you the big stuff, but they will give you medication and watch you. Now, what about if my blood pressure starts going down, right? They will change the dose. Instead of 5, they go at 2.5. Instead of taking twice a day, they will give you once a day. But they will take you off no medication. They reduce because you want them for life. That's why they say, if you don't have blood pressure, if you're not on birth control, you're 35 years old, you're not on birth control, you haven't been on it, why you go try birth control? Hell, you can't pronounce no birth control. If you go on birth control, it just gave you hypertension, right? So that's why a lot of African Americans, they go through menopause, they don't take Prempro. They just beat the hell out the kids. When you take the Prempro, a lot of Caucasian women do because they want to feel whole again. So they take, but those drugs give you breast cancer, right? So birth control not only give you DVT, it gives you hypertension, it gives you breast cancer because of the ingredients of the estrogen, progesterone that's in it.
And then
Oh,
Sonia, if
yes.
you have blood pressure, some doctor will not give you blood control.
Of course
You
not.
have a heart attack.
He will have a heart attack trying to be on birth control. Okay? Yes. Let's continue. Now, so sign and symptoms of blood pressure. It can be asymptomatic. You don't even know you have it. And guys, it has nothing to do with big girls. You can be big and still healthy. Yes. Okay? Headache, visual, dizziness, chest pain, tinnitus, flush face, epistaxis, nosebleed. Right? Goals. Okay? Goals. Ready? Take your blood pressure medication. When your blood pressure is, look, 180 over 100, PO cannot help you no more. We're going to give you IV meds, and we can give you nitroprusid or Regetin, or hydrazine. There's no doctor going to send you home when you have this here. Too high, you can stroke out. High blood pressure, right away, stroke out. Okay? Now, I know it's break time. Let me write the skills for cardio. So now you're going to teach the patient which food to eat. Right? Which food to eat to take their blood pressure medication. Right? On time. Low sodium. Fruits. Okay? Now, skills for cardio. Guys, come on. The proper way to take BP, no cross leg. It's in the book. Proper way to take BP. Apical pulse. EKG. Cardiac cath, which we did yesterday, teaching. Okay? CPR. Okay? Those are your skills. And sometimes in NCLEX, sometimes we put heart sounds. Heart sounds, S1, S2, to hear it. So you're going to have to go to YouTube and to hear it, just to hear it. If you hear S1, S2, S3, that is heart failure. So that means these are the skills for cardio. That means you're going to get, oh, one more. I don't, just listen to this. I forgot. Oh, I said it yesterday. EKG. Remember how to put the 12 lead. 12 lead EKG. And if you knew you didn't do EKG class with me, calm down. I'm going to do EKG with you. But how to put the 12 lead EKG, you need to do it in your board. And as I call these out, you get your skill sheet, you put cardio. If it's eye and ear, you mark them. And when do you supposed to do the skills?
Fundamental.
Okay? Any question? Some people did math, and all you did was came for cardio. Let me write the calendar for next week.